At BID-Milton, we can offer a comprehensive sort of range of therapies and treatment options. Everything from headaches to neck and upper extremity pain, certainly low back pain and lower extremity pain. We can manage complex regional pain syndrome. We can do simple things like cervicalgia, myalgia. A patient can be evaluated at Milton with pretty much any primary pain complaint of any duration. And we help to manage opioids as far as recommendations for tapering or, other issues that, physicians may have around these medications. And we can provide those services very easily here. Most injections can be done here as well. Certainly anything that's fluoroscopically guided can be done here. And it's a relatively easy transition process to get folks over to the main campus if needed, whether there are more advanced technologies that need to be utilized to do the injection, like CAT scan, CT-guided, say, facet cyst ruptures, or CT-guided sacroiliac joint injections for quite elderly patients where fluoro is not going to be quite an adequate modality to use. But it's an easy transition. So they go into Boston for their injection, they come right back to Milton for any further evaluation that's needed. So there really isn't a limit to what we can do out here. Like I said, other than for some narrow injections that we would bring you into Boston for. I think ease and convenience is probably one of the best things that we have here. Boston's Boston, so to pay for parking and it's hard to get in that area, and your PCPs are out here in the community. If you're not from Boston, you're not seeing APG and BI in the main campus. So there allows for not only ease for patients, but ease for physicians too. It's easy for me to call a referring doc here and say, hey, the patient is coming in with this. It looks like their symptoms have changed slightly. Did you have any other concerns? It's an easy phone call. It's an easy walk for me across the street too, just to say hello. And I work in radiology, itself, meaning that I have direct access to the radiologist as well. They can't run away from me when I have questions about imaging or scans. So I think that's a huge part of it. You are in a community-based setting. It's a little bit of a family atmosphere out here, which is hard to do in a place like BI Boston, though we try. It's a big, big center. And here there's just a little bit more ease, I think, of coordination of care. And, our physical therapists are local. They're just upstairs. It's easy to kind of go up and say, hey, this patient's not quite doing well. What can we do to help to modify their program? Their biggest issue is they have 3 stairs in their house and that's what they can't get up. So how do we get them to that point?